Hey Wendy, how you doing? This is Damian. Thanks for hopping on this video chat with me. Glad you had a couple minutes here, and I guess let's get started. Where are you joining me from?
Good morning, Damian. Thanks for having me. I'm joining from Watertown, South Dakota, where it is actually sunny today and almost 50. It's a good time of year to have
Yeah.
this, I guess. We had snow last week, so you might have gotten some snow in the background for that. So.
Yeah, we did. It was funny because we had like 4 or 5 inches of snow down in Lincoln, Nebraska, and
Yeah,
then
you had more
the
than we
next day
did.
it was green. It all
Yep.
melted, and we actually worked on our outside in our landscaping this weekend. So that's pretty
Yeah,
funny.
Sioux Falls had more than we did. I had to drive there last week, and yeah, it was crazy. Like driving down the interstate, which I do a lot, right? Because I travel. But yeah, it was interesting to see how much they had more snow than we did, and I'm farther north. So
Yeah. Well,
right in
hey,
the corner.
yeah, I guess that's what we have to expect. It's been crazy weather-wise, so.
Yep.
Yeah, good old Watertown. My son plays hockey against some of the 8-year-olds from Watertown, so I get up there a couple times a year. It's fun.
Well,
So
next time you'll have to stop by and see me.
I will. Yeah, sounds like a plan. So give us a little bit of a background. How long have you been with Cornerstone?
I am starting my seventh year with Cornerstone. I've been consulting for 15 years. Like John Lim has me by about 6 or 7 years. He was doing it about the time I met him. I've been working with him for the same amount of time. We follow each other around. Yeah, no, I've been consulting 15 years. I started in healthcare about 10 years before that. I did finance. I did budgets for 7 corporations. And then I was in IT at Avera, which is a big hospital system here in South Dakota. And I installed the 15 hospitals in Minnesota, Iowa, and South Dakota for them, the whole Y2K thing.
Yeah,
So I did a lot of all of the implementations and a lot of support for the financial applications. So I do, billing, AP, supply chain is the big one, revenue cycle, anything around that, patient access, medical records, all that's good stuff.
that's great. Wow, it's a wealth of knowledge there, and yeah, glad to have you here at Cornerstone. Sounds like you came over right when I guess 615 or Expanse hit the ground, and you
Yep.
probably were responsible for the majority of our Expanse projects.
I started with Magic and being an accountant with a background of that, the keyboard, being keyboard driven was really nice.
Yeah,
And I
fast,
remember
right?
having to teach nurses. I've had to teach, if you can believe this or not, PCS. I've also taught Epic and all of the clinical sides of that. And getting them to use a mouse, they had to, learn solitaire. I went into nursing so I wouldn't have to type and, all these fun things. I've had a lot of adventure with the teaching people to use the mouse. So that was fun when it first started.
That's funny. Brings back memories. I think about that time. I was still at Meditech, and I remember my first foray into Meditech was with implementation as an implementation analyst, and part of my job was to train end users how to set up their dictionaries, use the system, etc. And I remember Magic just having that the numbers keys on the
Right,
top keyboard for a computer. They
right.
used to have this cheat sheet. It was like a
Yep,
little
the function.
plastic thing that
Yeah,
you
the thing that
pull
went
over.
around your function keys. Yep, yep.
Yeah, we used to people used to come train, and we didn't have them available for sale or anything. People would just try to walk out of them from the training room. So part of my job was to make sure that nobody walked out and stole those from us. But yeah, those were a commodity back in the day, and I
I think
remember flying through a Magic system. It was really quick and easy. How you holding up? This whole COVID-19 social distancing. I mean, we're off the road and stuff, but like, how you holding up? What's going on with it?
this is the longest I've ever been home in the last 15 years. Now that I was calculating that this morning, um, I'm holding up really good. My kids are here with me. They go back and forth to their dads a little bit, and I go back and forth to my husband who lives in Minnesota. So we make it work. So I still am on the road a little bit, but in a different way. I have to go to Sioux Falls every 3 weeks for on the downside of my cancer treatments. So that's good. I got rid of it all, so that's good.
That's
Just
great.
trying to do all the preventive stuff. So I still get out. Like right now, I'm doing radiation, so I go out every day, which is weird. But my sister made a good example. I live in South Dakota, very rural. The people are out. Farmers are always out, so you see cars and you see that kind of thing, but not too much. My sister lives in San Jose, and she was telling me she's working because she has a nurse. She works in a nursing home. She's a director of HR, and from Sunday to Thursday is what she's working. And she said there was a freeway that she could never take because the traffic, she would never get there. And it takes her 45 minutes to go to work. So the one day she went on the freeway that she's never been able to go on, and there was nobody on it, and she got to work in 10 minutes.
That's
Just to show
amazing.
you, and she had a real misconception about us. She thought we were because of the way that they're portraying South Dakota and Christina. We can only go. I mean, our restaurants are closed just like everybody else's. Carry out, that kind of thing. The grocery stores. We're not going anywhere. And she thought we were still having parties at restaurants and things, but I said, no, we're also social distancing. You can walk down my street and see we all get 6 feet apart. It's quite funny actually, because we don't have the volume. You know, she has more people in her city than we have between North Dakota and South Dakota. So, you know, as a comparison, so sorry, I talked too much.
No, love it. That's interesting. Yeah, the highway thing, that's funny because I had a physician's appointment the other day, just a follow up, and I hit I was going through town and nobody's on the streets. I look up and I'm like, wow, I'm like going like 30 miles over, and I hope that doesn't incriminate me, but
right.
I was like, I should not be going this fast. I'm going faster than I should on a highway through town. Right. Didn't even think anything of it. It's crazy.
I'm just thankful they haven't tried to close the border because I don't know how I would get to my husband. But anyway.
Yeah, no, that's true.
It's silly things you didn't have to think of before, right?
Yeah, definitely. Okay. Times have changed.
That they have.
It's back. So COVID-19 presents new, different challenges. What are you keeping your eye on? Like, where are you seeing that people are able to spend a little bit of effort or time focusing or thinking about how they do the general financial side of the house to help them through times like this? Like, what are some of the main topics, hot topics, main issues?
With supply chain, it's the vendor list, reference list. GHX has kept theirs up. They just updated it last week. And GHX is the automated, for automated POs, automated invoices. Your vendors go through there. If you're automated on Meditech and want to use that feature, it's usually used in the bigger hospitals and bigger cities because more vendors are tied to it. Mm-hmm. You still have your local vendors. You have to keep that relationship up with, and you're talking to them and making sure that everything's, that you can get what you need, or that you've kept those relationships up. I think it's a good time with materials management, if you haven't set up things around automation, letting it, using the system to run the pick list, see what you got, deplete it, take your inventory, your par levels. You might have to think about, we were able to keep just-in-time inventory before. Mm-hmm. I could get it in 2 days. They're always trucking. They're always moving. Things might have slowed down. What are your high-use items that you're not getting as quickly? I looked at Becker yesterday. They have a seminar coming up about surgery, and I thought about that was interesting, and also one about how people are handling the patient financial. I noticed, as an example, when I first got cancer and started getting my bills, it's a different side of it, right? Because now you've always worked in it, but now you're the recipient of that. And Avera had a new mandate that January 1st they were going to call everybody, and they did. And I've noticed now with COVID-19, I've gotten none of those calls. Like if I didn't pay the bill like right on the money, or if I wanted to negotiate, they were on top of calling you before you even tried to pay. So they were doing, so some of that collecting has gone away because they know people are in crisis. But how do we ramp back up for that? How do we ramp back up for, okay, as an example, surgeries might start again in a month or two. Did we take the inventory, the supplies that we needed, the gowns, the caps, the masks, the pads, the different things that we, the IV sutures, everything, did we move it somewhere else? And now we've got to make sure somebody's got to go back in and make sure the surgery's ready, that they're going to have to make sure they can get the items that they need, order it ahead of time, be thinking forward thinking, be more reevaluate, think about resiliency versus strategy. Oh, I can get it just in time. Now I can't. So, in how you can use the system to do those things. I think it's a very important time because it's changed, right? Supply chain has changed. Finances, collecting has changed. Using your accounting system, the way that you need all that detail in your accounting system when you can get it out in the modules. I think a lot of people are not educated on the reports, that each area comes with. And now with what is it, business analytics that they've got at BCA. What they, they're, it's offering a lot of things. Expanse is great. The reporting is still, it's a work in progress, right? So, sure. I know Ozark's one of our clients. I don't know if I'm supposed to say that, but they had some GL reports and they're trying to convert them and they're trying to build them themselves because they can bring them over. But if you changed your chart of accounts during your expanse, you got to reevaluate those. And
Yeah.
so I was helping do that. I've helped do that at some other clients too. It's that you can bring the reports over, but you may have to change them because you changed your structure when you went to expanse.
Sure.
Some of those things that are lagging behind because we haven't had time, maybe those people have time. There's a value in keeping them on versus furloughing them. I don't know, but I think they're going to have to really reimagine how they do supply chain and how they have used their system in the past. Especially since they've had to furlough, they've probably had to do some of that, and there's going to have to be a bigger communication between the clinical side and supply chain. I know surgery, we've really integrated that better, but with some of the other areas, they need to be talking more.
Yeah, there's definitely an opportunity to use the system to automate a lot of things that slip through cracks. So
right. Well, we've always done it this way. Or for example, I live in a rural area. When I implemented hospitals, I know we used to we're trying to count the inventory, and we're having to go to the little room in the floor because the nurses, because of the weather here, and you have it in Nebraska too, they hoard things because again, they can't get them in time. So it's some of that thinking isn't bad right now, right? Because of what we're going through.
If you know where it is, yeah.
Right, exactly. And that's the problem. Well, Nurse Betty knows where it is, but nobody else does. But we had to go through a lot of drawers. I just remember the one hospital I did. We were in like weird rooms trying to find stuff that people had hid.
Sure.
To count the inventory. Yeah.
That makes sense. These types of scenarios and events and situations really kind of expose those types of things that happen in operations and organizations. So it's really interesting. Right. I know you're doing some work on trying to put some tips, documents, etc. together. I'm not sure if we're going to be doing a webinar coming up. I think we might. I'm not sure. I think we'll probably try to have you maybe help us put some things together for that.
Okay.
Also, keep in the back of your mind if there's things on the reporting side that you're seeing. I'd like to maybe internally or talk to some of our partners out there, put together like a package that people can deploy rather easily to kind of start to approach some of the areas that you just mentioned. I think this is an opportunity for organizations to just get tighter in how they leverage the system. You never know who's going to be here, who's going to come and go, who's going to be distracted, who's going to have to go back on the floor and actually provide patient care and can't get to the day-to-day. Oh, yeah, I know that this is under this notebook on this quadrant of my desk on Thursdays. And then I put it over on that shelf. That's the type of stuff that's becoming exposed. And, it's a style thing. It's a personal thing. I get it. In these types of situations, though, it's really being able to leverage all the investment that we've made into health information systems that really can either help you or become a hindrance or a challenge for you as an organization. So yeah, thanks for your work on that. I appreciate that. What's your prediction on when we get back to some sort of normalcy? I ask everybody, and it's interesting. They're similar but very different answers. I'm interested.
It's funny because today the doctor talked about that, if you can believe that. He said that they're looking here at trying to get the elective surgery part back up here pretty soon.
Oh, good.
Down in Sioux Falls, they're predicting the pandemic's going to hit the middle of May for them. Right. They've transitioned all of their the cancer center, for example, has been moved away from the main campus. They had a beautiful facility there, really relaxing, really calming, and they've moved it south of town into their new specialty hospital for right now. And you can tell the difference. You can feel the difference. And so it was interesting to hear they want to keep everything on main campus because we have that Smithfield plant.
Yeah.
That they found so many workers, right?
Yeah.
And I think that what they're doing is they're keeping all the buildings on main campus for the COVID-19 and moving everything else out. Anybody who's healthy is going to the specialty hospital.
Gotcha. So they're trying to
keeping them separate.
Yeah.
So we could be up, I was predicting probably fall, maybe September, October, because then they could get in all those elective surgeries. People have hit their deductibles, right? So they want to get it done before the end of the year if they've hit it. So that's what I would say. But it was interesting for the doctor to say today they're really trying to get back up within the next month for surgeries or so. So because we only have like 13 cases, and we've only had one death, and it hasn't really risen up here. The Sioux Falls has been unfortunately the big impact. From what I've heard.
Huge impact. Yeah, I think at the plant they've gotten over 200 employees actually.
Right.
So, yeah.
And they found another Smithfield plant. I know my husband said last night there was another one. I know there's one in Colorado, and there's another one that they just didn't take the precaution when they could have.
Yeah, we have one down here, so hopefully
they did a better job. Their management did a better job.
Yeah. Well, it's hard because you never think it's going to happen, and then it does, right?
Oh.
And
it really makes you reevaluate, reimagine, rethink a lot of things that you didn't think about before. So, I think I agree with John that we're going to see more clients who are open to, I think they have the initial meeting, we have to go there, we have to meet them, they have to get to know us, and we have to do our initial workflow studies and things like that. But I think many of them will figure out, and I know I worked hard at my last client to get them to understand, I don't have to be here every week. I need to be in contact almost every day with people. So you may have to, reimagine more of these types of calls and, more emails, like set a time every day. I'm going to talk to you at this time, because I think they'll talk to you more when you're not there. They're really, it's historically been, I'm sure your experience is the same, is that if I'm not there, they don't talk to me. So if I make them by having a set time every day, but I also save them, I can work more hours for them and get more done, and I can save a lot of money not having to travel. I mean, I like the travel, it doesn't bother me, but we don't, they can reimagine it. I think now this will help them with that. So
yeah,
I think it'll be going forward, but we'll have more of that.
Yeah, I agree. I think it's already taken place. It'll be interesting to see how much they're able to reverse after this is done, and how much they'll just continue to do remote.
Right.
Distance type of stuff.
So I had really good success on my last 2 assignments with the same client, but different aspects of it, of not having to be there every week. Like we were able to get down to, I was there like every other week, and it worked. We were on time. We were getting our stuff done. They focused more when I was there. They really realized when I wasn't there, things weren't getting done. So it helped them reimagine and reevaluate too. So I think it's there. It's just doing it and figuring out what works for you and the client.
Yeah,
But I'm always here.
I think that hybrid is effective a lot of times when people are surprised about it, but it forces some, I guess, touch points of reality, right? Like you go away, you come back, and like as long as you can identify and you're good at debriefing. Okay, by this time we were supposed to be here. Where are we? Obviously, and then also for the procrastinators, it gives them something to push the surge. So they're coming back next week. Let's get this done.
They're coming back next week. I should have been done. And I know the one girl said, it was great having me there, but the 1 week I wasn't there, she was like, it's kind of good because then I have to think long. Like I think faster sometimes than they do because I've been doing it longer, and I get that part. And they just have to. And she was like, no, you not being there made me think it through. I had to think it through all the way. You didn't help me. So there's the advantages to that. I was trying to teach her how to analyze it better too. Like if this doesn't work, because their IT resources they just didn't have a lot in the financial side, and that's happening more, I think too. So, we're of value. We're always here. We're always available. You can contact us through our emails and our phone numbers, because probably most of them still have mine. Mine's really easy to remember because it looks like a business phone number. My husband is very proud. But yeah, they can always, they just know they can reach out to you. And if you're always, we are pretty good at being available, right? So when they've needed me on Saturday, I have answered. I probably shouldn't do that a lot, but they have, if they need me, that's when they've had time to get in and dig, and then I've answered their questions. So, we do go the extra mile that way and do a lot of that. So.
Well, great. Hey, thanks very much. You look great. I'm glad to have you on the video chat. Thanks for joining me here. And have yourself an awesome week, and I'm sure we'll be talking soon.
Okay, thanks, Damian. Let me know if you need anything else. Thank you.
Thanks, buddy. Take care. Bye-bye.